Welcome, everybody. This is Nicole Yohalem from the Forum for Youth Investment, and I'll be moderating today's webinar. We're really delighted you could join us for the webinar entitled Improving Quality System-Wide. This is the final session of a three-part series called Strengthening City After-School Opportunities, New Insights, New Tools. Each webinar has highlighted a new study or report that was commissioned by the Wallace Foundation and developed by after-school experts. We're really thrilled to report that interest in the series has been outstanding. Nearly 1,000 people have tuned in to the webinars, and many more have access to the information online. The series is co-hosted by the Collaborative for Building After-School Systems, the National League of Cities Institute for Youth Education and Families, the Forum for Youth Investment, and the Wallace Foundation. I also want to thank our communication partners who really helped to get the word out, the After School Alliance, the Coalition for Community Schools, the Expanded Learning and After School Project, Grantmakers for Education's Out of School Time Funder Network, the National After School Association, the National Collaboration for Youth, the National Urban League, the National Institute on Out of School Time, the National Network of Statewide After School Networks, the National Summer Learning Association, Spark Action, Strive, and United Way Worldwide. So let's see, before we jump into the content, we wanted to get a sense of who is on the webinar. Do we have, well, we'll hang on for just a moment to get the results. Here's how you ask a question during the webinar. We really want to encourage you to send in your questions. So you click on the Q&A box in the right-hand corner. You select all panelists and from the menu, and you just type your question in and hit send. So please feel free to send in your questions during the webinar. So it looks like we have lots of program staff on the call, which is terrific, some TA providers. We have folks from local intermediaries, which makes a lot of sense, some statewide networks, and some funders, which is terrific. So we have a nice mix. All of these stakeholder groups are really critical in building and sustaining quality improvement systems. So welcome to the call, and we are glad you are here. So I mentioned that today's webinar coincides with the release of a new report. This one is from the Forum for Youth Investment and the Wallace Foundation, and it's called Building Citywide Systems for Quality, a Guide and Case Studies for After-School Leaders. The guide is free online at our website and in the Wallace Foundation's Knowledge Center, and it includes a step-by-step guide to building a quality improvement system along with 6 case examples, 2 of which you're going to learn more about today, and then a diagnostic tool that can help you and your colleagues assess where you are in terms of readiness and capacity to do this work. So we really hope you find these new resources useful. So here's a list of who you're going to hear from today. After I do a little bit more stage setting, we're going to hear from Charles Smith, Executive Director of the Center for Youth Program Quality and Vice President for Research at the Forum, where I work. He's going to tell you a little bit more about the contents of the guide that I just mentioned as one of the authors. Then we're going to have a chance to hear from 2 local leaders who have really made important strides building quality improvement systems for after school, and that's Laura Lafuente from the United Way for Greater Austin and Denise Williams from the New York City Department of Youth and Community Development. So we are excited to hear from them. And I want to just remind folks how to ask a question if you want to do that at any time during the webinar. So before I hand things over to Charles Smith, who's going to tell you more about the core content of the guide, I want to say a few words about why focusing on quality is so critical for the after-school field. In short, quality improvement needs to be a top priority for after-school programs and systems for 3 pretty simple reasons. First, it matters. Quality matters for young people's outcomes and programs. Quality is measurable, and most importantly, it's malleable. We can improve it. So I'm going to talk for a minute about these 3 M's. First one is quality matters. In 2007, Joe Durlak and Roger Weisberg published a review of after-school program evaluations. Found that on average, programs made a significant difference on all 4 of these outcome areas, so attitudes towards school, social behavior, grades and test scores, and problem behaviors. So it's great news, right? After-school programs affect important outcomes, academic and otherwise, but as is often the case, the story is a little bit more complicated than that. It turns out that when they scratched beneath the surface, they discovered that it was a high-quality subset of those 40 programs, really just over a third of the sample, that were driving those overall positive effects. And the programs that lacked certain quality features, that were not active and engaging and that didn't offer explicit skill-building opportunities, were having no effect whatsoever. So quality matters for achieving outcomes. Second, quality is measurable. really since 2002, when the National Research Council, or the NRC, released a report that focused on 8 features of positive developmental settings. Consensus has been building since then, really, about what constitutes high-quality practice in after-school and youth development settings. In the new guide I mentioned, you'll learn about 3 research-based assessment tools that align really well with that NRC framework that I mentioned, and that are being used in the field to drive continuous quality improvement efforts. And so those 3 are listed here, and you see on the right-hand side the common elements of quality that all 3 of those instruments and many others are really designed to measure. So quality matters. We know we know how to define it, and we can measure it. It's measurable. And the last M I wanted to talk about was malleable. So we know quality matters. We know we can measure it, but who really cares, right, unless there are manageable, affordable ways to make it better. Again, there's some good news to report. The YPQI study, the study of the Youth Program Quality Intervention, I think the first experimental study of an after-school professional development strategy, involved a diverse set of about 90 after-school programs across 5 networks in 4 states, and the study tested whether a continuous quality improvement strategy that included assessment, planning, and aligned coaching and training could improve program quality. And the short story is that yes, it does. And you'll hear a little bit more about the YPQI later because it's being used by some of the case study sites that we feature in the guide. So I am now going to hand things over to Charles Smith, who is Executive Director of the David P. Weichert Center for Youth Program Quality. Charles is one of the authors of the new guide, Building Citywide Systems for Quality, and his expertise was really critical to that work, to that project, because he and his staff have helped over 80 after-school networks around the country now build quality improvement systems. So he's going to summarize some of the core content of the new guide before we hear about 2 local examples. So Charles.
Thanks, Nicole, and hello, everyone. In the guide, we attempted to do a few key things. First, we described 7 common components of effective quality improvement systems. These common components were really the it of the work. We also described a progression of 3 stages that city teams went through to build and scale those components. The tasks that define these stages are really what the guide is mostly about. I'm going to talk about the components and stages here, and perhaps we'll get into some additional cross-cutting themes that we discovered in the work during the Q&A. But first, however, let me say just a bit about our method. There was a methodology used here to develop the case studies and the work. We started with, just in simplest terms, we started with a framework of our own experience and the things we've learned from other evaluation and policy research. We then did interviews with local experts in each city to document how they talked about their own quality system building work. Then we fit those stories to our initial framework of components and stages, and we made adjustments. We got very deep perspective out of those interviews, and they helped to guide our thinking about the framing for the set of common stages and the set of common components. Once we had made those adjustments, we sent those drafted case studies back to local experts, the ones that we interviewed and some additional folks, as a validation step to get their perspective. They told us where things were missing, where our framework didn't fit, and in general that they thought it was pretty good. Then we made final revisions and produced the published case studies that are in the guide. You might call this a grounded theory method or an iterative case study method, but there was a methodology behind the information that we pulled together in the guide. Let's talk about the 7 components of an effective quality improvement system. As I said, this is really starting with the ends in view, in the sense that these are the things that exist at the end of a QIS building process. They're pretty self-explanatory, as the bullets on the slide suggest, but I'll make a few selective comments. First, it's worth noting in the first bullet that a shared definition of quality is a really important part of this process. While science can tell us some important things about how quality should be defined for after-school programs, and as Nicole noted, a growing body of research does tell us that quality matters, is measurable, and is malleable, the definition of quality has important local variations, and it requires buy-in from local stakeholders. The process of considering the definition of quality is really a key opportunity to discuss the kinds of experiences a community wants its children and youth to have. So while there's a whole lot of guidance out there about how quality can be defined, this discussion is also a really great opportunity for stakeholders in these communities and the others that we know of to talk about their shared values for child and youth experience. So this process of coming to a shared definition of quality is really a core piece of the work. If you skip down a couple bullets on the 4th component, the continuous improvement model, Here it's important to clarify that this is a site level or an organization level component. While there are a number of different kinds of supports that are available in the quality improvement systems that we learned about, training, technical assistance, management information systems, common funding applications, these sort of kind of system-wide common elements. This component, the continuous improvement model, really refers to the importance of having a clear articulation of the steps that you want site staff to go through to improve quality. This is really where the quality improvement systems for after school have differed from other types of education and human services reform. It's a real strength. These systems have been very strong on implementation fidelity. They tend to be very clear about what they'd like site managers and their frontline staff, the teachers and youth workers who work with kids, to do to improve quality. In the case studies, we heard about site managers and really in our experience in a lot of these discussions, really embracing these opportunities to build their own skills and work on quality of child and youth experience. The fifth bullet, information systems, I think here it's just enough to say that we're really talking about a management information system. Quality improvement systems produce bits of information, and the data has to go somewhere so it can be managed and utilized. I'm not going to say a lot more here. National League of Cities has just produced a really terrific report on this topic, so I won't say anything more on that one. Finally, in the last component, adequate resources, that's here because it costs money to build a quality improvement system. And I think our primary point here is to say that in the case studies and in our experience in general, the scope and sources of those resources were really widely variable. This is true in terms of both the total investment, the total amount that it costs to do this work, and in terms of the per unit costs by place. There's wide variation. We also see a lot of variation in the mix of sources from which resources flow, as well a lot of variation in kind of the line items within budgets and funders where resources are drawn from to pay for this work. Because quality improvement system work is, depending on how it's designed, it's also adult learning system work and professional development and evaluation. So resources from those lines in organizational budgets can be repurposed to fund quality improvement system work, and were in the experiences of our case studies. So with that said about the key components, I'd like to move from really the ends to the means and discuss the stages and tasks that we've identified in the guide. This is the pathway to building the effective components that were mentioned first. Through our work, we identified a sequence of really 3 stages. They were plan and engage, design and build, and adjust and sustain. Both because this discussion of the stages and tasks are fairly complex, and because this is the core content of the guide, I'm just going to mention a few points about each stage. In the first stage, plan and engage, we already discussed one of the key tasks, which was developing a shared definition of quality. However, there is another key defining task in this stage, and that is clarifying the ultimate purposes that the quality improvement system should serve. Quality improvement systems in after school can serve a number of purposes, as I alluded to in the cost discussion. They can be adult learning systems. They can be put in place for accountability. They can serve evaluation purposes. So decisions about how and how much data gets collected, how those supports in the system are distributed, what kind of expertise the lead organization needs to have in its staff, these decisions in turn, they impact what the cost is to implement the system and what current funds are available to support the work. In the guide, we discussed the task of clarifying purposes in the terms of higher and lower stakes approaches, and this is a really important discussion, really right up there with the definition of quality. In the second stage, design and build, many of the tasks here are focused on, again, that site-level continuous improvement model and the supports necessary to make it work. It's worth noting here that the continuous quality improvement is not ultimately the work of a system or an organization, but it's the work of individuals. So articulating those steps and roles that participating sites and their managers especially are expected to implement is very important. This is where critical accountabilities for site management can be applied. In the guide, we refer to the site manager being held accountable for implementing the steps of the continuous improvement model, rather than the ultimate scores, the ultimate quality ratings, but being held accountable for the steps of the continuous improvement model as a lower stakes approach to accountability. Finally, for most of our case studies, the adjust and sustain stage was the go-to-scale stage, although you're going to hear from Denise in New York City, where they were really able to start at scale. So it's a really interesting counterexample to the pattern that we've seen elsewhere. I think the critical point in all of this discussion in the adjust and sustain stage is that this is really an iterative process, that as you start to build cultures of performance improvement across sites and across systems, those folks will want to improve the quality improvement system itself. So it's an iterative process moving forward, and the quality improvement system itself evolves. I think that's probably enough about the core components and the stages. Just as a quick piece of advice, as I've looked at the guide, I think if you wanted to get a better feel for the information that I've just covered about core components and stages, you might skim just the graphics in the book and then read one of the case studies and see how the elements of the stages and core components apply in one of the studies. And that'll give you a quick introduction to the content of the guide. With that, I thank you, and I look forward to the rest of the call.
Thanks, Charles. I have one follow-up question for you, but first I want to say that folks should see another polling question appear up on their screen. We want to try to get a sense of where you are in this work. As those of you who are listening in, are you just starting to learn about quality improvement systems and after school? Do you think you're in the sort of early planning and engagement stage? Would you put yourself in the stage 2, design and build, or do you think you're in stage 3, adjusting and sustaining? So we just want to get a sense, and acknowledging that those are overlapping stages, as Charles mentioned. So, Charles, I wanted to ask you, despite the fact that we did have to sort of lay out the stages and tasks in a linear fashion in the guide, in your experience, are there one or two things that you feel are critically important to building a QIS that really just cut across the stages that you want to highlight before we move on?
Well, I think the critically important, while the stages may not always be sequential, certainly the shared definition of quality and the purposes for the system are really, really important. We saw some other kind of cross-cutting outcomes in the work that are noted in the guide. I think two of those that are really important, and I think also actually coincidentally are part of the presentations we're about to hear. One of those is the emergence of a common language, as not only within organizations where this is a tremendous effect, but across organizations as a common language for how we do continuous improvement, how we define quality, and even what our common aspirations for child and youth experiences are. As that common language emerges in a place, in a city, I think it's very empowering, and it certainly provides a foundation for collaboration. The other part that I think Denise may talk about, and which the New York example is really a terrific example of, is the coming of a performance culture. I know in Denise's interview and in the case study in New York, they really felt the presence of change in the kinds of people who were coming into the agency and how they thought about performance improvement and continuous improvement as a kind of cultural shift within the organization that led quality improvement across many, many sites in that case.
Mm-hmm. Great. Okay. Thanks. So I think we are going to turn to two local examples, but first I want to tell you what the response to the poll was. It looks like we have a lot of folks who are in the early stages of this work, which is great, which is not surprising. So 31% of you told us you're just starting to learn about this, and another 30% told us you're in that first stage of planning and engagement, and then another good chunk of folks who are further along in the work in the second and third stage. So I want to just remind folks that there is an assessment tool in the guide, a sort of a self-assessment, a diagnostic tool that helps you and your colleagues at the local level assess where you are in the process. And it could, especially for those starting out, it'll be a great way to sort of figure out which steps you may want to focus on first, which part of the guide is going to be the most useful given where you are in the work. So I encourage you to check out that tool. So I am going to, we're now going to move to two local examples. These are both featured in the guide itself as case studies. And first we're going to hear from Laura Lafuente. She is the Director of Target Graduation at the United Way for Greater Austin and has been doing this kind of work over the past several years. And she is going to tell us first she's going to introduce the work that they are doing locally around quality improvement system building. Then we're going to hear the same kind of overview from Denise Williams in New York City, and then we're going to loop back to both presenters and ask some questions to get a little deeper. So, Laura.
Awesome. Thank you very much, Nicole. I appreciate the opportunity to share Austin's work. Just wanted to provide some context for the audience about kind of where we were when this process started and when I came into the process. At the time, United Way was actually moving to their community impact, or some people may know collective impact, in terms of working with partners and coalitions within the community to achieve greater impact. So that was kind of happening at a United Way perspective. We also had the Central Texas After School Network, which is a professional organization here in Austin that had really also been looking at program improvement tools that focused, mainly on program staff. And at the same time, our local Ready by 21 coalition had actually just received a grant for training and technical assistance with a quality improvement focus. And I think that definitely accelerated the process for us to start creating this out-of-school time and quality system. And I think the system, as we approached it, definitely was an approach of engaging and planning kind of more accelerated, but engaging kind of the professionals in the field and the experts, which were a lot of the out-of-school time workers and program staff who were already doing the work to inform how we developed a system here in Austin. And it has, really worked in that perspective. I would say over the past 4 or 5 years, we've really been able to get capacity built within our local community and have people who are invested in this process from their local staff and program to continue the work moving forward. And as a United Way, we kind of serve as more of an intermediary role to provide the support to actually have organizations request assessments or to actually attend the professional development trainings that are offered that are aligned with the actual assessment tool. Just wanted to highlight with folks the example of kind of what our improvement system looks like and kind of how we developed it from the beginning is really looking at encouraging an ideal perspective to have folks actually assess their programs, create an improvement plan and look at the data, send staff to their professional development opportunities, reassess a program later on, is really focusing on the fact that it is a continuous improvement process. And as Charles was mentioning, the system is being refined over time. When we started and had a vision, it looked one way, and over time we know that these are the main components, and there are additional pieces that as a community we really want to add to it. We always focused on this being a low cost to no cost to different programs, and really looking at this as, since folks are kind of dedicating their time and attention to it, most of the folks who are doing this are doing it on a volunteer basis. So in terms of paid staff, it would be myself and the time that I spend on this and either a Vista who's helping facilitate the process. But the majority of this work is being done by staff.
Great. Thanks, Lauda. We'll have a chance to hear a little bit more about what they're doing in Austin in a moment. But first I want to take us up to New York City, and I want to ask Denise Williams, who is Assistant Commissioner of the New York City Department of Youth and Community Development, to tell us give us an overview of the system that they have been building in New York City around quality improvement.
So good afternoon, everyone, and greetings from New York. It's actually a beautiful day today. So I just wanted to talk to you a little bit about our work, and a lot of times we're dismissed because we're so big, but a lot of what we've done, as Charles mentioned, really fit with the stages that you all will be going through. So I'm from the Department of Youth and Community Development here in New York City. It's known as DYCD. DYCD funds a lot of different initiatives for youth and adults, but really I wanted to really highlight that we have about 7 different things going on in the area of youth development, and a couple of should be familiar, as like Beacon Community Centers are now a national model. But a lot of what we're going to talk about today started with the launch of OST. And in 2003, the Mayor Bloomberg, tasked our Commissioner Mulgrath to lead a planning effort to really centralize the funding for after-school, out-of-school time, and which would be centralized in DYCD, but more importantly, as a strategy, one strategy for improving the quality of services that the city was supporting in after-school or out-of-school time. And it took 2 years of planning, and the planning process involved other city agencies, community-based organizations, of course, DYCD, representatives from the mayor's office, TA providers, amongst others, and that planning led to the launch of Out-of-School Time initiative in 2005. And what's interesting about our OST is that we went to scale from the very beginning. It started out with as few as 400 programs, scaled up to about 600 programs, and we're right now at about 430 or so, run by 200 community-based organizations. We've made tweaks to the model since its inception, obviously, first in 2008, and then more recently, last year, we released another request for proposal that led to the model as it is today. One of the things that's interesting about our out-of-school time system is that from the beginning, and I think this really reflects the different viewpoints that were part of the planning process, is that it was defined by our commissioner in leadership as three core components, meaning we thought we couldn't have quality services if we didn't also support capacity building and evaluation. And one reason that's interesting is that if you're a private foundation, you can fund, kind of the premier organization and pick those out. If you are a city or a government entity, you are about funding services in the highest need communities. At least that's what we're about in New York. And what we found, and what other city leaders may find, is that the strongest organizations aren't always in the neighborhoods of most needs. And you could do two things. You could walk away from those neighborhoods, or you could fund the best providers in those communities and then commit to helping them get better. And I think, our defining the OST system as capacity building and evaluation really reflects our commitment to funding in under-resourced neighborhoods. What's interesting about that is that even though, of course, New York has a great history of capacity building, professional development, lots of groups like the After School Corporation, Partnership for After School Excellence, the launch of OST in 2005 was the first time that the city invested tax levy funds in what we would call, an intermediary or non-direct service agenda. So I wanted to highlight for you kind of our system or infrastructure to support quality, and particularly to call attention to the fact that except for the circle, which is the programs of the community-based organizations that we fund, all of the rectangular boxes were work that DYCD had to do itself to support quality. So it was sort of us getting our own house in order. I wanted to highlight two in particular, or three. DYCD Online, which those of you who may have participated in earlier webinars on, data management systems may have heard a little bit about this. But with the support of the Wallace Foundation, we invested in a lot of time in the development of an online web-based system that is for program management. And not only does it really help the CBOs or the individual programs see how they're doing in enrolling young people, who their young people are, what kind of activities are kind of most popular with the young people. It lets us do that on a system-wide basis. And that was actually the first time that the city of New York could really have real-time information about what was happening in our after-school programs. And so Charles alluded to this earlier about programs using data. So this helps individual CBO leadership look at their multiple OST programs from a system level, but also allows us to look at our 600 programs. As to the third category, the program quality monitoring tool, when OST launched in 2005, DYCD had as many monitoring tools as there were, youth development programs that we were funding. So as a first strategy, we participated in the work that our statewide after-school network was doing, the New York State After-School Network, in their development of the quality self-assessment tool. And so coming out of that work, we decided to, quote, bastardize that, if you will, and really tweak it and use it as our first approach to using a monitoring tool that enabled us to check on things that kind of focused on youth development quality aspects, relationships between the young people and themselves, the young people and the staff, looking at the quality of the programming that was offered. And that was a big step for DYCD. After that, a couple of our other program areas like Beacons and Teen Action developed tools related to the quality self-assessment tool. But I think critical for DYCD was its own work with Policy Studies Associates a couple of years ago to develop our own monitoring tool and have our own definition of quality. And it took us, I would say, a good year and a half to get all of our assistant commissioners and their staffs on the same page about this tool. So that was kind of a landmark piece of work for us. And what was also important wasn't the development of a tool, which is, a piece of paper at the end of the day, but that we agreed on an approach to monitoring that was more about coaching and support and partnership with our CBOs to support quality, and that we would really commit to sending CBOs who are having issues to our technical assistance unit as our primary strategy, as opposed to more of a punitive approach to monitoring, which is what some of our units have been doing in the past. And then lastly, I wanted to say, again, we are committed to professional development and technical assistance. And one amazing piece of work that we did with community members, TA providers, CBO staff, academic professionals, other city agencies, was led by the New York National Institute of Out of School Time, where we developed a set of core competencies that the city of New York could commit to, core competencies for youth work professionals and core competencies for their supervisors that are really the guiding framework for our investment in professional development in New York City. So I'll stop there.
Thanks, Denise. The scale of what you're up to there is always impressive and humbling. So I am going to ask a couple of questions, and then there's going to be time for us to take some questions from participants which are coming in. So please feel free to add questions in the lower right-hand Q&A box. But I want to talk about three, if we have time, I want to ask you guys about three key issues in building a QIS. These are each of these are steps in the process that we go into depth in the guide. And I want to ask you both a couple of questions about them. So this first issue of stakeholder engagement, you're both actually funding agencies, which is interesting, and yet in Austin, the QIS is not limited to United Way grantees. In fact, CBOs were pretty deeply involved in developing the system, right? So Lauda, can you tell us a little bit more about how that has worked and how you've managed sort of your role as a funder in the process?
At this quality system as being developed and implemented by out-of-school time providers for out-of-school time providers. So there was this realization that if this system was going to work, we really wanted to have buy-in from those people who would be using this system so that could be sustainable over time. And the Central Texas After School Network has offered incentives for organizations to be involved if they've gone to one piece, how they can participate in another piece. As a funder, at the time when we were developing this system, it was open to anyone who wanted, and it continues to be open to any organization who's interested to use whatever piece is most relevant, even though we would like to encourage them to go through the entire process of assessment, professional development, planning with the data, and all that piece of it. Most recently in our request for proposal, we did make that as part of a requirement for participation and to receive funding, was that organizations that were looking to receive funding from United Way, they would have to have participated already in the quality piece of it, and that part of their contract and one of the measurables is, are they currently participating and sending staff to the professional development trainings? My understanding is also our local school districts have required that of any of their vendors as well for them to also be a part of this system.
Great. It'll be interesting to watch as that becomes a requirement in Austin, if the dynamics shift at all in the process of engagement. Denise, I wanted to ask. In some ways, your story at DYCD is more of an internal stakeholder engagement story, right? So, talk a little bit more about that buy-in process internally and what you've done to really foster a culture shift inside of this very large agency.
It is kind of intriguing because I think we will reflect what a lot of CBOs have to go through to get their staff and teams on board. And so, as I said, we fund a lot of different program areas. They all had their own assistant commissioner and other directors, if you will. And so I think the hardest process for us was to engage all of the internal assistant commissioners, program operative leadership, in a discussion around and coming to some agreement around what does quality look like for us, what are some common themes for us. And I think it was really helpful. There's smart people that were looking at the conversations in the field, and so we used a lot of what was happening in the field to fuel our dialogue. And I think that that's helpful as well, so that our CBO partners know we're not making up things randomly. We are looking at what's the best out there. I think what was also interesting is that our commissioner at the same time was committed to bringing a lot of staff into DYCD who had experience, either professional development experience leading youth development organizations, after-school organizations. And so if you look at the profile of OST as the leader of that movement, there are a lot of people here who are leaders in their field who brought that expertise into DYCD. So I think there was a readiness to begin that conversation to move us from really what was a monitoring culture to one that was a coaching and supportive culture.
Mm-hmm. Great. So I'm going to shift to this number 2 here, clarifying purpose. This is a step in the process that happens in the guide. We feature it sort of near the end of the planning stage. Charles talked about this a little bit in the beginning, how important it is to be clear about the purpose and what sort of level of accountability or level of stakes are going to be at play in the system. Lauda, you've been really intentional in Austin about keeping the system low stakes. Do you want to tell us what you mean by that, how you came to that decision, and whether you anticipate any shifts over time? You've talked now about starting to require participation in the RFP and for funded programs. Can you just talk about sort of how you're thinking about that locally?
Sure, absolutely. And when we talk about low stakes, I think we really looked at the tool that we were able to use, and it has been intended for more continuous improvement over time. It wasn't meant to be an evaluative tool. So I think keeping that in mind, we intentionally left it low stakes. I think partly also because of capacity, we've kept it low stakes as well, and just allowing organizations, because the interest is in improving program quality, not having this, carrot and stick model, but it's just about having people and organizations, professional staff, enter the system where it made more sense for that particular organization. I would say, we've also been very intentional about, the scores and making sure that the scores aren't widely accessible to everyone. We'll look at scores on an aggregate in terms of how the community is doing, but we won't necessarily share scores about individual organizations except for the individual organizations for that same reason. That's not necessarily the intention of this tool. The tool is really to be focused on the quality improvement process itself and more about the discussions about what the scores may mean necessarily, not about the actual score itself and how programs can improve. Mm-hmm. I think I was going to say shifts over time. At this point, I'm not envisioning a major shift except for just that requirement of organizations participating, not having to look for a particular score.
Mm-hmm. Great. Denise, you also talk about the DYCD effort in terms of it being low stakes and focused on improvement, yet there are some potential negative consequences for low-performing programs in your system. Talk about how that works and how have you been able to keep the emphasis on improvement while still there are these real consequences for some agencies?
Well, the thing I would want to highlight is that our program quality monitoring tool has like 8 categories and 16 indicators in each category. So there is no one indicator or anything like that kind of overrides, and that our process includes if there are areas lacking, we work with the CBO on what we would call a work improvement plan or corrective action plan. And that these ratings, yes, do inform the year-end performance evaluation. But what's more interesting, I think, is that it's really the focus is for us on enrollment and retention of young people in the programs that can have consequences in terms of funding. And some of you know that we have a performance-based system, but our performance base is not tied to the youth program quality monitoring tool. It is more tied to things that everybody knows about in terms of enrollment and retention of young people. And that if there are areas, our first strategy is always about referring to technical assistance and really maximizing the use of that investment for DYCD. And I will say that if you were to talk to CBOs in New York City, it has really been important for us to walk that talk because it takes a while for your partner community to understand that you do mean that you want to partner in change and that it is not a punitive system. It is hard for folks to take that in when you are a funder.
Mm-hmm. Mm-hmm. Let's shift to sustainability. This is an issue that we sort of bring up in the beginning of the guide as an early step to think about, and then we talk about it more near the end of the guide. Denise, let's start with you. I know, like lots of public agencies across the country, DYCD has faced some pretty significant budget challenges these last couple of years. Talk about how the recession has affected your agency and what have there been implications for this work related to quality improvement?
When I first heard the term PEG, I couldn't understand what that meant. For others not in city government, it's called a Program to Eliminate the Gap, or budget reductions in plain English, and we've gone through 12 of them. But as I highlighted in the slide, our commissioner and our system has defined, been defined as capacity building and evaluation. And so while we could have cut that out easily, and, it's really a hard choice to make when you're looking at slots, as they talk about it, for serving individual young people, we knew that these indirect services were core to our ability to survive. And last year, I would say we went through a really hard time of potential cuts in New York City, significant cuts. But the one thing that I think sustained us and really kept the system from being decimated was that no one, from the city council staff to the mayor's office to the Office of Management and Budget to our CBO partners to parents, had anything negative to say about the quality of OST. So that was never a discussion or a question when I was in front of the city council testifying. It was all about where do we find the money. And so when you're going through these hard times, it's easy to say, okay, let's cut workshops, or let's cut training, or let's cut on-site consulting. But at the end of the day, I think those things are important to sustainability, so that people can't say these aren't quality services that we're offering, and that the question becomes, how do we find the money to keep these services going?
Mm-hmm. Yeah, that's quite a testament to what you've been building there. Lauda, let's go to you. In some ways, I think your work in Austin on quality improvement has really been sort of a gateway into broader OST system building work in the community. So talk about how you see this work evolving, on the quality work you've been describing, and how it fits into your larger sort of strategic vision at the United Way around OST.
Absolutely. So I think we definitely are focused on continuing to strengthen and sustain the current quality. I mean, that definitely is a high priority. But and I think, as I mentioned before, since working with volunteers, we're always looking for ways to financially sustain the work. But we've also identified that there has been a need, in addition to looking at the quality piece, but also looking at access and data and sustainability over time, and always with collaboration in mind with our partners, with other municipal entities, with other funders in this space, to actually really maintain the work and have a more robust system for our local community. And that continues to be something that we're focused on, and looking to really support the different organizations that have already been involved in this work to start to develop a greater system within the Austin area. Great.
Thanks. Okay, we've gotten some great questions in from participants. We're going to go to some of those, and I'm going to, assuming Charles is still with us, I'm going to bring it back to Charles for a second and ask him to be the first to respond to this question. I'm going to start with a hard one. The question is, with limited funding, given there's limited funding and that research shows positive youth outcomes result from programs that are high quality, at what point do the stakes need to increase, and at what point does funding need to be redirected to expand high-quality programs? So somebody's cutting right to the heart of this question about accountability, and I want to first ask Charles if you have any reflections on this question of when do we move to higher stakes systems, and how can we do that in a way that is effective?
Yeah, so that's a tough one. I would say that, at this point, if we're talking about the relationship between quality and child development, there's not a ton of evidence out there to support high-stakes decision-making. From the quality rating and improvement system field, now there have been important reviews of the research evidence on both thresholds for quality, at what levels we think the quality of experience really matters for child-level change, and on the validity of the quality rating systems that are in place. And, let's just say we're very early in that process. So if we're looking to the evaluation science for a certainty to support a decision, we're probably not going to get it there right now, although there are a lot of hints. And so then the next answer to that question would be when we, one, put more measures around the quality decision, because one of the challenges is the issue of reliability. And, how we can draw a line and say programs below this have a consequence, but that's really tricky for the programs close to the line, as we know from teacher evaluation systems across the United States. So more measures improve our ability to make those kinds of decisions, and then there's also a decision when the stakes are improvement-related stakes. So if we're trying to, the point that Denise made was really critical, that, a lot of programs that have challenges are also in challenging places, in challenging geographies. And so we don't necessarily just want to get rid of them, because that's the most negative consequence, right, the end of funding. But so when we have multiple measures to help us have a broader picture of a better certainty about what high and low is, and where the consequence is more focused on improvement. And then, once you go through several stages of improvement and improvement doesn't occur, then you're in a better position to make, decisions about funding being eliminated. So I think it's a place that the field is going, but we're still figuring out, gaining clarity on the conditions under which those kinds of decisions can be applied most effectively.
Mm-hmm. Thanks. I want to go to another question. It has to do with champions, and I think I'll ask Laura and Denise to weigh in on this one. The question is, were there any key champions that were really critical to your success? And let's see if Laura and Austin, do you want to speak to that a little bit?
Sure, I think absolutely. I think, of course, the Central Texas After School Network, the professional network, I think I would consider them a champion. And I think in some instances we've also had like the school district and their 21st century programs have been champions of implementing and infusing this with the vendors that they work with. I think over time, additional champions have emerged. So we've started to get greater buy-in with our local city and their parks and recreation, and also through the health and human services. So I think over time we're developing, as we're working with partners, in terms of how do we start getting that message of quality across to other groups to influence maybe other champions and positional levels of authority.
Great. Denise, any reflections on this question about champions?
I think one of the things interesting about having a business person as a mayor is that corporate America really gets the concept of investing in people and professional development and consulting and all of those kinds of things. And so I think that was enormously helpful in New York City, and his appointment of our commissioner, who brings a professional development background, so had the support of the leadership. Outside of that circle, I think Wallace was enormously helpful to us because they introduced us to things that were happening nationally, and New York is competitive, so we want to be as good as what's happening everywhere else. And so we learned a lot and took that in. And then locally, folks at Children's Aid Society and Good Shepherd Services, some of the leading nonprofits were already doing some of this work internal to their organizations. And so we were able to learn from them, and having them be able to champion this work to stakeholders who, again, may have a hard time seeing the value of this indirect funding was really, really important in critical moments around budget conversations.
Mm-hmm. Great. I have another question that I think is relevant probably to both of the sites, and it has to do with sort of rethinking if you could do it all over again. Not that we want either of you to start over again, but if you had a chance to start from scratch, which neither of you really did because that's not how it works in the real world, but is there something you would do differently if you were beginning this process a couple of years back? Anything that you think now that you know what you know, you would advise folks listening in to do differently? Laura, anything in Austin?
I think on the early on, I think we had a brief amount of time to actually plan for this, and I think planning would have been a little bit more helpful. Like you said, knowing now, planning I think would have been helpful. I think definitely setting out clear expectations for organizations that are involved, and having more dedicated time to just focus on this, I think would have been extremely helpful through this process. It's been, an important piece of the work that we do, but it hasn't necessarily had all of the focus that it could have. So knowing that this does take time, especially in the way that we've developed the system, and having that support would have been incredibly helpful.
Mm-hmm. Denise, any thoughts as you reflect back?
Ideally, planning is nice. We did do planning. Ideally, we would have had our own tool earlier in the process, but I do think the evolution of our system over time, and Charles mentioned that it's iterative. You go forward and you go back and, sideways sometimes. I think it enabled us to bring more people along, so I'm not sure even that was kind of a mistake. I think we got to where we got to in the time that we needed to. So no, I don't know that I would say that's a mistake. I think, ideally maybe we would have done that earlier, but I don't know that the agency was even ready to have that conversation earlier. So.
Mm-hmm. Yeah. You mentioned the quality assessment tool, and I do want to talk about data. There was a question here about data. After-school staff are not always necessarily experienced, right, working with data and interpreting this feedback in the form of data. So, and yet these continuous quality improvement systems tend to include a step whereby staff are really reflecting on data that they get back. Can you, maybe Charles, we'll start with you, but can you talk about what does this performance feedback look like, and how do we engage staff who may not have had any experience working with data actually looking at this feedback from these tools to improve their practice?
Yeah, so we tend to think about data as becoming most important when it becomes information, and that's not just a semantic difference. There's a definition. So when you bring the data into a group and decide what it means. Our experience, I think, has been people, totally rise to the occasion when the data can become useful information, when the data is worth rising to the occasion. So, if the data is important and relevant, people see the value in its use. That has not, then it has, the production and the management of that information has not been nearly so much of a challenge when people see why they're doing it.
Mm-hmm. Lauda, I know you guys do a workshop down there called Planning with Data, where staff come together and look at their scores and talk about. Do you want to describe that a little bit or reflect on this question at all?
Sure, absolutely. And I think we've learned so much more over time. Again, the whole process of refining of the system is that at first, there is, because of the tool that we're using, there are scores that come back. There is kind of evidence in terms of what someone observed when they were looking at a program, and this is an opportunity for the site-level person who was observed and their supervisor to really look at the scores and come up with an improvement plan. And I think as we continue to learn more, there's also some interest in having the coaching involved and to look at what someone may have seen at that particular point in time. And I think that is kind of how it's used, is at this particular point in time, this is what was observed, so that someone is looking at data, an external person is looking at data, or an internal person is looking at the information to really identify what someone from the outside may have looked at. So I think it is an intentional part of the process to have someone not just go through this assessment piece, but also look at the data and submit improvement plans and also follow up on that process of improvement.
Mm-hmm. I remember when talking with you all and some of the other case study sites, just hearing folks telling us that staff are just hungry for this kind of feedback. We're not always, especially in these kinds of direct service jobs, there's not always a chance to pause and get concrete feedback on what you're doing and have the time for reflection. So it sounds like it's really important. I am going to give one last question, another doozy, another hard one. I'm going to kick it to Charles. And the question is, how do we think about the relationship between these quality indicators we've been talking about and child and youth outcomes? The question is, don't funders want to know what the outcomes are and that their funds are being used in accordance with their intended purposes? So talk about how, I know you've been thinking about this a lot, talk about how these quality scores relate to child outcomes and the work you're starting to do to think about that.
So I think the short answer is that these quality scores relate to child and youth outcomes in ways which are a little bit more complicated than our current research is helping us know about, but we're definitely on the way. And, the science of observational measurement, of measuring settings, of measuring adult behavior is still fairly early. It's, moving quickly into policy in both the after-school and out-of-school time world. But, one of the things that this kind of information does is it really empowers people to mobilize their own theories. So what is it that I think is really good? What are the experiences that I as a professional, or we as a community of professionals, or community of professionals and parents, What are the experiences we want kids to have? And this kind of information, because we have theories about child-level change, which are, quite important. And this kind of information allows us to tell if we're doing the part that we think we are. Are we delivering the experiences that we think we are? And, humans are notoriously bad reporters on their own behavior and experience. And so having someone else observing that process of, all of these systems are so powerful. These quality improvement systems have been so powerful in ways that perhaps the quality rating and improvement systems in early childhood and some of the teacher evaluation systems that are emerging have not, in the sense that the supports have focused on how the data goes back to the staff. So the staff already have ideas. It's not completely about the reliability and rigor of the rating itself, but it's about how the data moves back to individuals who want to work on their performance. And so, yeah, child outcomes are what people want to work on. I think we're headed there as a field. I think there's some interesting work being done in that front right now, and we know some things like high quality programs produce child and youth engagement in that moment when the quality's being experienced. Is child engagement an outcome that funders are interested in? Some. We know that if you string together a series of moments with high quality experience and child engagement, kids build skills. Are skills in the after school context the kinds of outcomes that funders want to know about? Yes, some. And we also know that sometimes those skills get built to a point where they transfer to other kinds of outcomes and they show up in achievement scores. And, that's, of course, everybody's interested in that. But so I think there's more nuance to be built into our discussion of what are the important outcomes that we're interested in. And I think just in our field, we're really empowering people to work on the outcomes that they think are important. So I think, that's a complicated answer to that question.
That's a complicated question that I ended on, but thanks. Thanks to the participants for sending in such great questions. There are a couple that we don't have time to, many that we don't have time to get to, but we will be able to follow up independently or individually after the webinar. So I really want to thank our speakers for joining us today and all of you participants for joining today. The webinar and the slides that accompanied the webinar are going to be archived on the Wallace Foundation and Forum for Youth Investment websites. So I want to just also say I want to thank Denise and Lauda and everyone across the country who is doing this work. We are seeing such incredible work happening in communities across the country that I wish we could have featured in the guide. We could only feature 6, but there's work going on all over the place, also at the state level, and we're really excited to watch it unfold, and we want to be helpful, and we hope the guide is useful. And I think that as you leave, I think I'm going to let our host close us out, but I just want to say thanks, and I think you're going to get a survey here at the end. So thanks a lot for participating.